Hello friends, Namaskar. Now we go over to communication skills. Communication skills in palliative care. We'll take basically 2 lectures. In part 1, we'll basically talk about little bit about communication theory and importance of empathy, why empathy matters. Because we are dealing with palliative care, we are dealing with health, medical health, where without empathy, nothing can move forward. And another lecture, I call it Communication Skills Part 2, we'll just we'll discuss how the communications should take place. In first part, we'll talk about 6 points toolkit, and then thereafter a class protocol which has been coined out in medical world. Friends, 2 things are very important in palliative care. We lay lots of emphasis on community participation and communications, and that is why the stream of palliative care medicine is totally, it has its own distinct points. It cannot be compared with any other medical stream in which you will find the importance given to the community as well as about how to communicate with the patients and the family members. Little bit about communication. Normally there are 2 types of communication, verbal and non-verbal. Where use of verbs is made, it is called verbal. So, where do we make use of verbs in English language? Spoken, like what I am speaking to, I am making use of number of words and verbs and adjectives and so many things. It's a use of English grammar with its total dictionary, spoken language. Similarly, the same thing is being done in written language. So, where you make use of any language, that becomes verbal communication. Non-verbal, simple as that, where you are not making use of any language, certain other things, signs and symbols are being used, that is called non-verbal. What is verbal? Conscious use of a spoken or written word. Conscious means I cannot write a wrong word, I cannot speak a wrong word. Importance need to be given that correct word to be spoken at the correct time. Choice of words again, which word you are going to use in your speech. Each word has got its own meaning. So, the choice of words, sometimes it can reflect your age, education, developmental level, culture. We cannot use abusive language in society, in public areas. No, it cannot be done. So, choice of words do matter in communication. Feelings, it can be expressed. When you are angry, you make use of lots of eyes wide out, you breathe heavily. Your feelings come out through your speech. Communication should be simple, brief, clear, well-timed, relevant, adaptable and credible. This is called the correct communication. It should be simple. The aim of using, hi-fi ornamental language is of no use. What's the meaning of, why do we communicate? We communicate our ideas so that they can be conveyed to the person to whom they are supposed to be. He or she understands our ideas and act upon it. That's the aim of communication. It doesn't mean that it has to be ornamental or flowery. A simple communication which clears the meaning, and sends it across to the person to whom we intend to communicate. That was verbal communication. Non-verbal, we use of gestures, facial expressions, behaviors. Gestures, normally we say, when I move my hand like this, I am calling somebody. When I say like this, don't come, go back, switch off the engine. That means you stop that particular action, that is what I am saying. I'm not asking you to close your camera, Ankur, keep it on. But this is what sign language, symbols, use of gestures, facial expression, behaviors, less conscious than verbal. Some of the non-verbal things come out automatically. It's not conscious. You don't become conscious about it, just comes out. You express it yourself. It requires systematic observation and valid interpretation. Sometimes non-verbal language has got double meanings also. So you got to be observing it properly. What are the non-verbal symbols, gestures? Eye is very important. Through eyes, how the eye is acting its part, you can make out. Eye contact, posture, including sitting or standing, pitch and pace of voice. What is the rhythm of my voice? Touch is also a communication. Therefore, we always emphasize, I told you in that lecture, low tech. What is palliative care? Low tech and high touch. High touch means a lot of care is required. So, that is touch. Two parts we'll see. Firstly, we'll say what is the communication skills in PC, and then in part 2, we will talk about the importance of empathy, why empathy matters. In palliative care, the focus is on the person with the disease. Normally in other medical streams, the focus is what? It is on the disease. They want to cure. So, they want to attack the disease with whatever is available in the medical world. They are attacking the disease. But here we are, yes, we attack the disease also, but at the same time our main focus is the person, whether the person is happy or healthy or not. That is the holistic thing what we are talking about, mental, physical, spiritual, everything, all factors we take into consideration. The focus is on the person with the disease rather than the disease. Therefore, communication is very important. Now, when our focus in palliative care is on the person, so how do we communicate? We have to communicate it properly. Therefore, the focus is on the communication. If you can convey your thoughts, or vice versa, the patient is able to convey his or her thoughts to the doctor or caregivers, then proper communication takes place. In palliative care, we treat the patient as well as we treat family also, family of the patient. Family is also part of the unit of care, and therefore again we lay emphasis on the communication, because we are supposed to communicate with the family members also. We recognize psychological and spiritual needs. Communication like tumor may be benign or malignant. What happens in a tumor? If it is benign, there is just no problem. But after biopsy, if doctor finds out that the result is malignant, that means you start worrying. It may be cancer, maybe something else, but not good for yourself health-wise. So in communication also, if your speech is good, if you are making use of good words, if you are not abusive, if you have a factor of empathy connected in your speech, then the communication is benign. It is going to help the patient. But if your communication is malignant, you have got ill intention against the patient, then yes, your communication is not good, it is malignant, and it will spoil the mood of the patient. You want to keep the patient cheerful, you want to keep the patient happy, and if you communicate badly, naturally he will be unhappy. The effects of bad communication with the patient may metastasize to the family also, and this effect of bad communication, of course, it goes to the patient, but it affects even the family members also. The transmission of information, thoughts and feelings so that they are satisfactorily received or understood. That's the definition of communication. Communication skills. Act of communication is an important part of therapy. Why I say? Because everything starts with the communication. In medical world, if a patient does not communicate properly to the doctor, the case history cannot be written. How will the doctor come to know about the disease of the patient? A patient has to communicate. Patient has to tell the doctor. Doctor has to ask so many questions, and that is how the doctor comes to know about the state of disease of the patient. And that is how the case history, the first part of chain of medical process, starts with the writing of case history, and case history starts with the communication skills. Sometimes when the patient is too sick, then communication is the only thing available. You can communicate so nicely, so it can act as the therapy, and therefore greater thought and planning needs to be given on the art of communication. However, sorry to say that this particular part is not being taught, it is not being looked after in our medical colleges. Communication was never a part of medical syllabus. Of course, now something has come up, a 1 month course of ATCOM, but communication needs greater attention in our medical colleges for the medical students. We have lots of problems if we do not have proper communication. We call them breaking bad news. How to break the bad news? That is where the communication is required. You have to give it out very softly. Denial, lot of patients, they deny, oh, this thing cannot happen to me. Again, you have to break the denial. No, my dear friend, just see, this is the result of your laboratory or any other test. This is what has happened to you. You have to understand. You can't deny it and get away. You have to accept that this is the disease you are suffering from and you need proper treatment. Collision can take place if the patient is suffering from a very serious disease. Then the family members will ask the doctor not to convey the correct information to the patient because it might hurt. It will create a shock effect and patient may die of heart attack. So collusion. The relatives of the patient and the doctor decide that this particular information is not to be given to the patient, but this is wrong, and therefore collusion also need to be broken. A time comes for a day or two, okay, fine, you may not convey that what has happened to the patient, but it is the right of the patient that he must know what is happening to him, to his body, which is the disease he is suffering from. It is his right. So let anybody say anything, but patient is supreme. Difficult questions, ethics and spiritual issues, emotional reactions, bereavement. There are so many issues where communication is very important, and with the help of communication, you can ease the tension, and the people, particularly the patient and the family members, can relax a little more. What's the need to communicate? And if we do not communicate properly, if we fail to communicate, what happens? We need to communicate so that anxiety can be relieved, better adjustment, mutual exchange of ideas and feelings with the patient and doctor, proper guidance and better compliance, involvement of the family, reduce tension, isolation, acceptance and trust. And if we do not communicate properly, if we fail, then what happens? Poor symptom control. If patient doesn't tell the doctor properly what is happening to him, how is the pain, where is it happening? Doctor is not God. Doctor comes to know about the state of disease and state of the patient from two factors. Firstly, what patient tells about himself, and secondly, from laboratory test. So, the patient has to communicate what is happening to him. If he does not say, then the poor symptom control. Doctor will not come to know about the disease and he will keep on writing the wrong prescription. Improper adjustment, poor compliance and lack of cooperation. This is what is happening in normal home also. Sometimes there is miscommunication, sometimes there is poor communication, and so many things happened. Worsening distress when proper diagnosis hasn't taken place, a wrong medicine is being given out. So, the sickness is not getting under control, the distress is increasing, escalating conflict, and patient and the doctor, they are not in proper relations, they start blaming each other, patient becomes too demanding, and sometimes medico legal problems also come up. Patient might go to the court, might go to the police because I have not been treated properly. So, this is just what happens if we fail to communicate, if the doctor fails to communicate with the patient and the patient with the doctor. What I am talking now, basically it is fine in palliative care, but communication is important in our normal social life also. If we do not communicate properly, if the teacher does not communicate properly, the students can't learn. If the parents do not communicate properly, the children will not understand what the parents are asking them to do. So, clear-cut communication is a must in our social life also. Consequences of poor communication, shock. If you do not know how to break the bad news, then you will create a shock effect. After seeing the report of biopsy and immediately the doctor says, sorry, you have got a big tumor and you are in a 4th stage of cancer, you are likely to die in few days, This is not the way. You are bloody giving shock to the patient. You must know how to break the bad news properly. So, understand your language should be proper. We generally have proper lessons how to break the bad news. In fact, everybody knows a child when he gets a poor result in the class and he wants to break the bad news when he goes to his father with his report card. What does he do? How does he break the bad news? He knows that his father or mother, they are going to rebuke, they will not be happy with him because of the poor performance. So, one must know how to break the bad news. You are not supposed to give the shock or emotional numbness. You cannot deny anger, anxiety, depression, guilt. These are the consequences, Communication is the art of individual clinician communicating with their patient. Clinician, doctor, how he communicates with the patient. And it is science also, ensuring this communication effectively meets the need of the patient. Whatever he says, whatever he speaks with the patient, those things must meet the needs of the patient. Goals of communication anywhere, whether in social field or whether in medical field, to reduce uncertainty, to enhance relationship. You have got good communication, you become fast friends. Give the patient and the family direction in which to move. After a major disease, if a patient finds out that he is going through, is undergoing, so he like to know what is going to happen. If a patient is suffering from cancer, he like to know what sort of treatment has been planned by the doctor, which direction they are going. Personal satisfaction. Problems in communication, frights of upsetting the patient because you don't want to give a bad news to the patient. So, these are all the problems. Ill-equipped to answer difficult questions, short of time, unable to handle the patient's emotions. We cannot make the situation better, that is, we cannot cure the patient. These are the problems with the doctors as well as the patients and the family members. Principles of good communication should be clear, complete, concise, constructive, correct, and courteous. 3 C's, that is the communication. Do's in communication: willingness to listen. You must listen to the patient. You must listen to everybody. Whenever somebody is speaking, listen his or her story properly and then respond. Encourage the receiver to talk, modify or adapt your communication as per the demand of situation. Maintain professional distance by avoiding loose talk. Difficulties for professionals, that is for the doctors. Doctors are generally busy. They don't have time for the patients because they are going from one hospital to another hospital, one clinic to another clinic. Sometimes doctors do not know the language of that patient also. So these are the difficulties for professionals. Patient lack of time and privacy. Sometimes patient thinks that, should I give this information to the doctor or not? How is it related? Sometimes the patient doesn't come up with the actual problem because he is afraid that something more drastic medical situation will come out. Some of the people, they don't go for biopsy report also. It is natural that we generally always imagine bad thing to happen first. They are afraid of the truth, afraid of the treatment being denied, fear of losing control, unfamiliarity of the surroundings, and the medical speech. Doctors most of the time speak English. They make use of medical words which normal patients do not understand. Patients might not ask questions because these are the barriers. Patient may not ask because normally doctor will say, "Bare bhai, you are suffering from this, my dear brother. I can't do anything for you now." They don't want to ask because if they ask something silly question, they say, "Okay, I look foolish, stupid in front of him." Sometimes doctor doesn't have time, Doctor wants to go to somewhere else. He wants to go to operation theater, anything. So he feels rushed. Doctor will say, okay, fine, just tell me in 1 minute, I want to go. Previously brushed up, didn't have good relations earlier with this doctor. So there's so many problems, communication problem with the patient. He doesn't ask questions to the doctor. Sometimes patients do not disclose properly because this is what has happened to you, happened to me. They do not want to seem negative or ungrateful, want to be strong, think their concerns are not legitimate, do not want to add to the doctor's burdens, believe nothing can be done. So these are some of the issues where the patients do not come out with the truth. Doctors also block communication when they give cues that they feel more, they have time pressure, allow distraction, do not acknowledge the patient's emotions, address physical aspects only, offer reassurance before the main problem have been identified. Therefore, I speak and tell everyone that whenever you are communicating, do not make use of mobile. Because when patient is talking to a doctor and the ring comes up and he starts using mobile, that means patient think that I don't have any importance at all. You just see he's talking to somebody else. When doctor talks to the patient, no distraction of any kind to be allowed. Communication should be genuine. When it is required, it is to be said. It is not for the pleasure of anybody. Yes, truth has to be given with simplicity. Love and compassion, they are the parts of communication, and empathy. This is what it is, effective communication in palliative care. Part 1. Part 2, why empathy matters. What is Palliative care, again I have given out. I want you to understand, this is the last time I am telling you about what is palliative care. Low tech but high touch. Our aim is, we do not want to add days into the life, but add life into the days. We want to improve quality of life and death with dignity, and we give proper grief and bereavement services. And therefore, communication and behavior with patients should be with empathy and compassion. Let's understand the words. This is the hierarchy. It is going upward like this. Apathy at the lowest level, then goes up to sympathy, goes up to empathy, and finally it is the compassion. Now, what are these four words? What is apathy? Apathy means lack of interest without feelings. A doctor should never be apathetic to the patient. If he is not interested in the patient, then he cannot serve. Pity means feelings of sorrow caused by the sufferings of others. Doctors should have pity, but not generally he should. Sympathy means you can understand what the person is feeling, just understanding only. Empathy means that you are feeling what the person is feeling. So, there is a difference of words. In sympathy, you understand the pain of the person, but in empathy, you are understanding also at the same time you are feeling the same pain in your heart. And compassion is a very big term. It's a willingness to relieve the suffering of another. Some more. Sympathy means you can understand what the person is feeling. You are not feeling that person's pain, but you want your friend to know you are aware of her suffering. In sympathy only you are not feeling the pain, but you understand generally what your friend is suffering from. Like it is here, friends. So, you just go there, speak to him, cases, something must have gone wrong. Maybe he might have failed in the exam, or maybe someone very close might have died in the family, or whatever it is. So, this is sympathy. You go meet your friends, just pat him up. Empathy means you feel what that person is feeling. Instead, you can imagine what it might be like to have your fingers slammed in a door, and that may allow you to feel my pain. Like one of your friends, it happens, his fingers, they just come into the door and he starts crying. So, here also again you feel, yes, what happens when your own finger comes into the door. Empathy. Here the caregiver is just taking the hand of the patient or the old person. The old person is doing that exercise with the medicine ball, and the caregiver or the nurse, whoever may be, sitting along with the patient. This is the spectrum of, in pity you use this word, I am sorry for you. Like some poor guy is just, begging for something, some money or something. So, this is what you feel, I am really feeling sorry for him. Sympathy, I feel for you, I understand what sort of things you are suffering from. Empathy, I feel with you, whatever is happening to you, how you are unhappy or happy, I have the same feelings in myself. And compassion, I am moved by you. This is what has happened. Really, I am with you, and I am going to do something so that such situation in the world can be changed. Compassion is the willingness to relieve the suffering. And that is how most of these hospitals and so many things, educational institutes, they come up because some people, they come to know that such situation should be removed. Compassion is a four-stage process. Awareness of the suffering. It can be anything. It may be in the matters of education or health. Sympathetic concern. They want to see the relief of that suffering. And the responsiveness, readiness to help. So compassion of people sometimes, they help the communities in large perspective. Most of the hospitals, educational institutes, even water tanks and so many things have come up because of the feeling of compassion. There's a poor guy, homeless person, Another image, apathy, you are not interested. When this chap is getting drawn, he is looking other way. I am not worrying, bloody you go, die. Sympathy is just standing there, come, I'll save you. But he's not jumping inside and catching his hand and taking him out. But in empathy, you jump inside the pond, pick up his hand, give him support and try and get him out, This is how it happens. Empathy, feeling the same, sympathy, understanding the same, and compassion, feeling care and warmth for the other person. This is a model for emotional unconsciousness and consciousness plus self and other distinctions, emotional model, mental and physical model. And this is how empathy, cognitive empathy and emotional empathy that matters. Way to show, be aware of another person's feelings, show sensitivity by looking at their facial expressions, ask questions to understand feelings, give a simple sign of affection such as hug or this is what we normally do. Whenever something happens, a child comes to home crying, what does a mother do? A mother picks up the child and straight, puts him or her in the hand and taking him upwards. It's a simple sign of affection, hugging the child, and the child becomes calm and quiet because he is in the safe custody of the mummy. Ways to show empathy, sometimes high five. What is empathetic listening? Active listening is a type of empathetic listening. You should listen to the person who is happy as well as who is not happy. The goal of empathetic listening is to help the listener to show emotions free from judgment or criticism. How do you listen empathetically? You feel, it seems like, as I understand it, you sound, it appears as if these are the words you make use of in your normal conversations of empathetic listening. Many more things are there. Behaviors to avoid in communication: do not judge others, do not criticize others, do not give a big lecture, do not keep on giving advice every time, and do not interrupt when the opposite person is speaking. These are the tips. In palliative care, hope is something, it plays an important part. We say hope is immortal. Hope remains. Never stop believing in hope because miracles happen every day. So in our language also, there should be always a factor of hope to be interwoven. Hope is an expectation greater than zero of achieving goal. Hope needs an object. Sometimes it is necessary to break down an ultimate goal into series of mini goals. Setting goals is an integral part of caring for patients with an incurable disease, even if progressive. Giving hopeful communication to the patient, to the family member, is very, very important in palliative care. Hope, gentlemen. I also hope that you go through this particular course of integrative palliative care for 3 months, learn something. It will be useful to you, to your family members, and to others also. Thanks. Thank you, friends.